Have you ever left your doctor feeling more scared than when you went in? If that's happened to you, it might be time to find a new doctor. In this video, we're going to be discussing the worst things that doctors or physical therapists can say when discussing a patient's condition. One phrase you'll hear, it's all in your head. Unfortunately, there's a lot of things that contribute to pain that can create that feeling. And when you invalidate it, you basically say it's not true, or maybe you're exaggerating, it's all in your head. That really creates a patient that gets very, very upset. Basically, the patient doesn't really seek treatment as much. They kind of feel like it's something that they can't control. There's several influences on chronic pain, which we're understanding now, not just the biological, like tissues injured. We have social issues that occur. We have psychological influences. So we really have to make sure we avoid using that phrase when we're discussing or trying to figure out a patient's problem. Another phrase we hear a lot is, this is the worst back, or you could say knee, whatever, shoulder, I have ever seen. And what happens is, you're an authority figure as a doctor or a therapist, it creates a label. And what it does is it says it's the worst. It doesn't allow a lot of room for hope or other options. A lot of times there's multiple things that you can do, even with what appears to be a really difficult or significant situation. You'll hear this tons of times with people who have been in tremendous car accidents and horrible conditions, and they were able to run. Never thought they'd run again. You don't want to take away that hope and that seek to get, that desire to get better by providing that label. You can say you have some challenges, there's things we have to work on, this is the road we're going to take, but to label it as the worst, it really creates a bad dynamic from the onset. Another phrase is, you have to live with this forever. It's really almost like a death sentence. This is what you got, and that's that. I've had a patient say to me, I thought I had to go to this with my grave. Interestingly, the same patient I met a few years later said, my pain kind of went away after about a year or so. I just lost some weight and changed a couple things in my lifestyle and less stress at the job. All of a sudden, this thing went away. It wasn't something I had to live with. So we have to keep in mind, just like we said earlier, we have to provide hope and options and look at the multiple factors that contribute to a variety of conditions, especially when we're talking about spinal-related problems, but that can also hold true for knee, shoulder, and other conditions that we treat here in the clinic or doctors treat. Just rest is one of the biggest things we hear here. We don't hear is just rest, but when do we stop resting? So we have a lot of people. I had someone that's a friend of mine that's been resting his shoulder for 8 months. I was beside myself. I said, tissues heal in a certain period of time. At a certain point, rest is not the solution. So what you should ask the doctor, if everyone here just rest, or let's say avoid the activity, how long? When can I get back to it? We really have to really inform our patients of a plan, not just rest. Rest is a 4-letter word. Modified rest is really what we want to embrace, and a time frame of when we can slowly incorporate new activities and get back to what we want. Okay, so remember that, just rest, don't want to hear it, or avoid that activity. You need surgery right away. We have to sign you up right now. I got my surgical assistant, we're going to get you on the books. If you hear that, run away. Most times. There's a few times where that's important. If there are serious considerations, you have to ask, if I wait and I see if my body can heal, time or going to therapy or trying other things, it's not surgery, is there any downside to that? Is there any downside for not doing surgery today? Now, there's a few things in orthopedics that you don't want to delay. They actually show that the outcomes are really not good if you delay. Sometimes it's a bicep tendon, it could be an Achilles, a full Achilles tear. It could be certain situations, or if you have a lower back condition where you're getting really weak because a nerve has been pinched, yes, that's a time for immediate surgery. But most times it's elective. So you have to really say, if I wait, what is the downside of waiting? Oh, you'll just be in pain. Okay. Or what? But you've got to ask that question. And when I hear that, it makes me cringe. You really have, and it can be excruciating pain. In fact, spine doctors will talk about this all the time, that they really don't want to do any kind of spinal surgery at least 3 months after a person has had pain. And 3 months is a long time to be in severe pain, but a lot of things get better in that 2 to 3 month period, especially in the orthopedic world. So we got to wait. Even if it's hard, we've got to figure out a way to wait, because doing surgery, sometimes it alters our anatomy. As one of my ex-mentors used to say, Todd Edelson, you can't unring the bell, you can't undo surgery. Surgery changes your anatomy. And it's supposed to help you, but it can also make things just a little different in the end. Next one, the MRI shows you have a back of an 80-year-old. Okay, so there's a lot of things you'll see on MRIs for people that have pain and don't have pain. So we have to be really aware that there's a lot of findings in MRIs that can scare people. They can appear to be someone that may have an older back, but not necessarily a painful back. So we have to make sure that the MRI, we don't treat the MRI, we treat the person, we examine them, we have to find out all the influences. Because what I will tell you, and it's a good way to think of this, MRIs and x-rays can't show you where the pain is. It can give you part of the whole picture, but it can't say this is the painful structure or this is the problem or the pain generator. So when you hear that, take a little pause, and I wouldn't say run out of that doctor's office, but really consider other opinions before you take any more aggressive steps, whether it be injections and surgery. There's nothing we can do. That's great. Maybe we can find someone else that can do something, okay? So if you have a doctor, he's got a white coat on, he might have been the bottom of his class, but he's still got a degree. He may not have the option, and he may not be the person that's the solution to your problem. But it doesn't mean there isn't a solution that you can't explore by talking to other practitioners, whether it be therapists, psychologists, physicians, physiatrists. So when you hear that, say, hey, I appreciate your honesty. There's nothing more you can give me. But it doesn't mean there isn't more options out there. You're too old to recover. This is just part of old age. I find that amazing. It matters how old you are. It matters what you've been doing. You have very, very inactive older folks that benefit from some very simple exercises, like getting a dog and starting a walking program. That's all they do. Or doing some very basic stretches and lower back exercise. Or trying to do more work in groups, getting more social to decrease their stress and their isolation. Addressing stress issues, nutrition, sleep, so many factors. So to say just because you're too old, there's probably a lot more things that you can consider, and I think there's a degree of ageism that we kind of just reflexively say, well, they're older, we just have to accept it. I really feel that I've had some of the best results with some folks that are older that actually just haven't been doing a lot. They've kind of had maybe a back issue for a while, and they've kind of shut down and really become less active when we really want them to become more active. The harder patient to treat or to really help out sometimes is that young individual that's doing all sorts of things all the time, and they can't manage all these things. They don't have the opportunity. They're exercising a lot. They're doing a lot of good things, and for whatever reason, they can't get the perfect blend to help their back problem. So I never look at age. Let's try and give them an opportunity, and let's not just look at that number. Let's see if we can get a move in to start feeling better. You're just overweight. This is the main reason why you're having back pain. Yes, obesity, being overweight is a risk factor. If you are, it could be a contributor to your back problem. But to say just that singular factor, that's the only thing that's actually contributing or might be causing some problems, most times is not really appropriate. There's a lot of other things that can go into why this person's having trouble besides the weight. Not that overweight is something that we want to promote. There's obviously other health conditions that are affected by someone that's got high BMI and that's overweight. In fact, I tell my patients, I said, listen, if you're having some weight issues and you're having some back pain, I go, I think it'd be great if you went and worked on losing your weight. And even if it didn't completely solve or even solve your back problem, it's good for you as a general wellness thing, okay? I think that is good for you as a person to get a little bit healthier. And that in itself should help with tissue healing, feeling better, feeling more confident, and can affect probably your sensation of back and perception of back issues. So consider that. You hear that, that's kind of a reflexive thing. I think you have to think of other factors, and there should be a more nuanced discussion of what else goes into your potential back problem. You're never going to be able to do such and such, pick the activity, that activity again. Okay, I think that is no hope. You're just saying you can't do it, okay, don't know, maybe you can't do it in a month, maybe you can't do it in 2 months, 3 months, maybe a year, but maybe you can, if you have the proper steps, get back to certain activities. I had an old therapist that was a mentor of mine, Steve Churchill, and I asked him, I said, is this exercise safe for a lower back condition, for this person that had a lower back condition? He goes, it depends. You can say this one is a higher risk activity and this is a lower risk activity. So depending on where the patient is, you may introduce some low risk activities. Say, why don't we try these first, develop some resilience, and then maybe we can get back to that previous activity. But to say you will never return to that is really, first of all, diminishing hope. And it doesn't, but a lot of people, if they take the steps, which is the hardest thing, is taking the gradual steps, we can get back to a lot of activities that we thought we couldn't. Okay, and I think it's just a very, it's inappropriate, it's a lazy answer to tell most people. But it does require a lot of work and good structure, depending on the severity of the particular problem. Now, I know a lot of doctors and physical therapists don't intentionally use these particular phrases or words, but I think sometimes we lose track of how powerful our words and how much we are authority figures for our patients. And we have to look at how those words can really impact a patient's desire or potential for seeing a potential opportunity to recover. What we want to do is say, hey, I'm going to try and work through these steps. If it doesn't work, we're going to change our plan. We're going to try and, take the appropriate steps and make adjustments if I can. And if I can't help you, I'm going to refer you out to someone that possibly to inquire further, maybe another specialty, another opportunity. But you have to empower that patient with some positive, just being positive and being upbeat and looking at that patient and say, we're going to do the best we can to help you out and get you past this. And really make sure that that patient is part of the journey, okay, is important. So we want to make sure all our patients take an active role and have good communication with their physician or physical therapist, and that has the best chance for the best outcome in there. And that's what we mean by really avoiding certain phrases and really making sure we're understanding the impact of our words is very powerful. Okay, hope this helps you out on your next visit to your doctor.